if I could just kick off with a question for both of you, really, um, because this is relevant to our international PPI network, for the work that I do in Cochrane and for other projects I'm involved in. When working with people across different countries, regions, different cultural backgrounds, what are the challenges of that for things like language and understanding and so on? And how do you adapt your work to those different cultural understandings?
Mogens, do you want to go or shall I?
Mogens, yeah, or what? Yeah. Should I take the first question?
Yes.
Yes.
Well, yeah, thank you. Well, we didn't have time to describe in details how the APND is organized. The core of the thinking is that nations should collaborate, which means that each of the nations, more than 30 participating, would bring up their own priorities, national priorities. And also we have and that takes care in the management board. Then we have a scientific advisory board consisting of very well-known researchers, mainly from Europe and some from the United States. They discuss the current challenges in research, being scientific, basic, being clinical, being health and social care research. So they will come up with proposals for calls. And the idea of the calls is that there will be participants from many, more than half of the countries participating, because it is the individual countries that finance the calls. So the basic idea of the collaboration is a understanding between the nations taking part. This is of course a challenge in itself, but the experience over the many years we have now worked is that the nations really participate. They bring funding, and the researchers that participate are the leading researchers and research groups from those nations. So this is also a way to disseminate the research that is going on in more than 30 different countries. Now, the challenge with PPI is, of course, as Alexander also mentioned, is that the level of PPI in these more than 30 countries are so different. And that's why we failed when we thought we should just send out some guidelines and then expect the research, the research groups that worked together to apply this. We now know that we must go another way, bottom up, some like Alexander just have described. But of course, we have not reached what we want to reach for now. Thank you.
If I may add a little bit to what Mogens said, I think by creating this network with different representatives from different countries and mostly the countries that participate in the calls, we will learn from them what are the really specific needs, because we don't have direct interaction with the patients in each project. So it would have the representatives of the network from the different countries will let us know what are really the challenges related to the cultural differences and to the way we do it. So this is why we think it's so important for them to participate also before the research is the topic, the call. When the topic is chosen, it's very important that the network participates and says, well, you see, in our country, this or that will be very different, very difficult. And this is one way. And another, we also decided that we're going to make a request in our calls that there will be involvement of all the countries, or if not, at least 3 countries on PPIs, because what we have seen with the consortium is often the countries with the more knowledge are the ones doing the PPI section, and the other ones are left out. And this just, perpetuates the same situation. So we want to be horizontal learning among the consortia. The ones with more experience will learn also from the ones with less experience. And this is a way to overcome, and we will make it a requirement in our PPI section of the course.
Thank you both so much for those really full answers. We're starting to get questions coming in now, lots of them. So this is thank you very much, people on the call for putting your questions to us. I've had a question from Barbara. She said, "How do you ensure that you recruit a diverse group of patients?" Particularly people who are often excluded from research. And I think the other thing for me that, what you were talking about is about the different pace at which different countries and regions work. So diversity in a whole range of different ways. How did you manage that?
Well, if I may start that one, and then Moens will continue.
Yeah.
The way we are doing this right now is really because we have such experienced people for whom diversity is really very important, and they have consistently raised that issue. We expect that they will introduce us to other people from more diverse backgrounds to join the network. On the other hand, for instance, in the panel review meeting, we had a lot of people from underrepresented countries at JPND, and we have made a point to request them to please advise members to join the PPI network from your countries, because we don't have many. And they were very, very enthusiastic about that. So this is the way we try to bring also from the very experienced members already in the network, and from other researchers with whom we meet at least once a year and ask for advice on their patient organizations and potential patient pools. Moens?
Well, I think you described the process we have been through and where we are. I don't think I would add anything now.
Thank you. And just to say that Virginia asked a very similar question there about being inclusive of seldom heard groups. So on that topic that Virginia raised, do you keep a record? Do you monitor the involvement of the diversity of the people that you're engaging with? Do you monitor that at all?
Well, so far we haven't done that, and I understand the question. Now, what we do is that we rate the applications according to as is described in 3 groups, A, B, and C. And among the criteria that we apply to place an application in group A, B, or C are the diversity of the patients plus other criteria. This is the way we can at least get some impression about how have the applicants, the researchers, prepared the application. Some, of course, come from countries where it's a routine to use PPI. If you go to United Kingdom, to the Netherlands, and so on, it's the way the PPI is introduced in the consortia. But it's even more important for us that those countries that don't have PPI as a routine, as part of research, is included in the PPI section of the call, that of the application that the group decides to send. So it's again a process. It's shared learning among groups within a consortium.
Very
Thank
well.
you, Alexandra. Yeah.
We give more value to a project that involves several countries and several diverse members on their PPI than a very nice PPI plan written by a country with a lot of experience on PPI already. So this is going to become a very important requirement for what we consider a good PPI involvement in the project. So it is exactly what Nolan said.
Thank you both for that. So we've had a question from Timo Tolpa, who asks how your work is funded, how the network is funded, because I think it's a common experience that PPI and research is often only available after funding has been approved for projects, and perhaps not for the development of things like networks. So how is this network funded? And also, do you remunerate patient and public partners, the patients who are involved in this research?
I think I could try to answer this. Well, the JP&D as such is a collaboration between member states, and it is the member states that provide the funding for the calls. Now, JP&D has been accepted by EU as a joint programming initiative, which means that there are funds available for the infrastructure of the JP&Ds as such, to manage the calls, organizing meeting in the scientific committees and so on. And now also for the PPI secretariat, we must admit that there are not a lot of funding available for the PPI network as such, but the members of the PPI network, most of them will be so interested in working in this, so they join just for free to participate in this. And this is not an experience that we know for other countries, that it's not that you get paid, it's that you get involved, and that the researchers listen to you, and that it is documented which kind of impact you have on the research. This is very important for those that decide to join this network.
Exactly, and I should add that any expense related to the PPI participation, travel and all that are completely reimbursed, of course.
Yeah.
And we do give a very symbolic amount to the people who have reviewed the project. We have the same but it's really symbolic. It's really not a payment. It's just a thank you thing. So it's not remunerated, but of course any expense. And we always recognize and acknowledge their work and try to keep them involved even after the project has been finished. This is our aim. So we are very early in the process. So this is just what we intend to do. We have already been reimbursing some, but no, it's not a paid process. No.
Right. Thank you for that. And it's I'm seeing a lot of sharing of resources online between people who are taking part in the webinar, which is lovely. People talking about the work that's being done in the UK's National Institute of Health Research, for example, and sharing. So we're trying to do the kind of thing that you're doing, I think, which is learning together. But here's a question from Claudia DeSantis about PPI practice in healthcare. How would you address doctors' reluctance to involve patients in the decision-making process? I don't know if you've got experience of that.
I would like to give a short answer and then ask Alexander to add on. Now, because this touches upon a challenge that all scientific committees have. How can you mix the ranking of the applications when it comes to the scientific rating versus the rating of the PPI in the product? Could you mix these in numbers and so on? I think we have got an interesting solution to that. And I will ask Alexander to explain where we are now and how we introduce that. My point is that because the review of the PPI has some impact on the ranking of the applicants for funding, then the researchers would find out next time we will do it in another way. Alexander?
Yes, if I may add to that. So the way to avoid resistance, and it's not only from doctors, also from researchers, is trying not to make it a burden for them. Just make them understand the value beyond reporting and that. And also we have realized that, of course, you have to put some money on the decision. And the money is that PPI now is in the process. This has not been approved yet, but we have developed a process. We believe PPI is a qualitative process, so we cannot rank it from 1 to 10 and 1 to 5. It has to remain qualitative. So the way we have proposed JP&D, and it's still for approval, is that the weight of PPI first will depend very much on the topic. How important is PPI for this topic of research? As we saw, health and social care is very relevant. Other topics are less. So the weight will depend on the topic. And second, the weight, the ABC rating that we have given. A will mean, based on this topic, the scientific rating should go up by 10%, let's say. B would mean, based on the research topic, we believe that PPI evaluation is fine and should not affect the scientific final weight. C is the PPI section of the project is so insufficient that we really need to lower the scientific score. But this is, of course, decided previously by the PPI network and then discussed during the panel review meeting. But for the first time, we want PPI evaluation to have a weight, not an average, not a quantitative weight, but a qualitative weight on all the projects involved. And the criteria will be the same for all the projects. And then each project will adapt according to that topic. This is what we intend to propose.
Thank you. We've had a question about the ABC rating system, which you've mentioned a couple of times. I wonder if you could just give us a bit, a little bit more detail around how that works. Is that possible?
Yes, we have a list of criteria we find relevant. And we are about, as I say, we are about to update the guidelines which had the criteria. Now we're going to be a bit more specific about the criteria because we realize that some of them are not very clear. We have some projects with a very thorough description of PPI, others very superficial. So there are minimum criteria that we have to have, especially the one with dissemination, which is very important. Based on those criteria, we will decide whether the project is an excellent PPI. PPI has seriously meaningful been considered, and excellent does not mean long. It means involved several countries. It means it involves good communication with the patients and public, and it involves publicizing your shared experiences. These are very important. B means, yes, some of the minimum criteria are met, but it could be better, but it's not enough. We don't think we should affect the scientific based on this. C is when we really think that the consortium did not take much concern on the PPI, and therefore we believe the final score of the project needs to be negatively affected. Again, this is very effective, very influenced by the topic. If we have a health and social care, we are much more demanding and much more exigent with what we want on PPI than if we have a very in vitro or molecular topic. Like we had this year, a very big data analysis. Well, we were very, very not so demanding on the PPI, but again, we want several countries to be involved and to be part of the PPI. This is really important, so we address the needs of everybody, and minorities and less heard people are very relevant to us.
I should add that these criteria that differs based on the scope of the call, they of course have to be published with a call so that the researchers know what would we be looking for. And they may change from one call to another call, but they must be published so they are known by the researchers. It's not that we have a list of criteria that we would apply without the researchers knowing what we will be looking for. And these criteria has been discussed and checked with the PPI network, which is very important because they apply their experiences for each of the calls.
Absolutely.